Hello, I'm Paul Danini. I'm the Global Product Manager for software at Agfa Radiology Solutions. In that short video, I propose you to look at how the patient care pathway could be optimized by detecting urgent pathologies at point of care. Patient-centered care has been a heavy trend within healthcare. There is extensive literature documenting the benefits to implement standards on quality of care and patient safety, not only to deliver the best patient outcomes, but also to keep motivation and job satisfaction among care teams. The extension of patient-centered care to radiology already started a while ago. The first major step took place back in 2006, when the RSNA established the first steering committee on the subject of patient-centered radiology. Unfortunately, considering the small number of radiologists compared to the number of images acquired, the reality is that there is a widening gap between the demand for services and the ability to meet that demand, which has led to the accumulation of many images with delayed diagnosis or without diagnosis. The impact of these waiting times could be mitigated by improving the communication between radiology and care teams. The principles of effective communication have been documented, for example, by the Joint International Commission in the International Patient Safety Goals. These request that hospitals define the critical test results that may prove urgent or life-threatening emergencies. Also, that hospitals develop formal reporting processes that identify how critical results are communicated to the healthcare practitioner and the expected time frame for reporting and acting upon these critical results. And last but not least, also that the hospital use standardized methods or tools to facilitate consistent and complete handover of patient care. Despite the lack of radiologists and the growing workload, some compensation schemes have been implemented to support a better patient care using communication aids. For example, the radiographers' abnormalities detection systems, RADS. What is it? Well, traditionally, the production of X-ray images has been the role of the radiographer, whereas the interpretation was the role of the radiologist, with a clear boundary. However, the delay in the interpretation and reporting of many examinations pushed the UK to advance the practice by combining the skills of the radiographers with the skills of the medical doctors to give to the medical doctors additional preclinical image evaluations in absence of the radiology report being available. So we can consider this as a fair success, as now more than 90% of the UK hospitals have implemented the RADS. And also other countries, like Australia, have decided to implement similar RADS systems in their country. However, these RADS also face limitations. It has strong training requirements on the radiographers. It also can create some ambiguity during the communication if the X-ray does not include preclinical comments. Also, radiographers lack of time to review the X-rays. And last but not least, these RADS have been currently mostly implemented in emergency settings, not in outpatients nor in ICU. That's where Agfa Radiology Solutions can contribute to support timely management of patients with urgent findings. We developed Critical Scan for our X-ray workstations. Critical Scan integrates at point of care Lunate inside CXR, an AI software CE certified and MDR compliant that detects suspected chest radiology findings with an extremely high accuracy. Let's see how Critical Scan aids communication within the care team to provide timely treatment by looking at the high-level care pathway of a patient that goes to the hospital for a chest X-ray. The patient gets positioned by the radiographers, then gets exposed, and after the X-ray is taken, while the patient is still close by, Lunate inside CXR detects a critical abnormality. Critical Scan notifies it to the radiographer, and then the radiographer just needs to follow the standard operating procedure of the hospital to escalate the exam as stat. That protocol can be different depending on the department. And in absence of the radiology report, for example during the night, the physician can review the X-ray and take into account the Lunate inside CXR report as a preclinical information to help him decide timely on the patient management while the radiology report is absent. This is especially useful for junior physicians as a safety net to either avoid missing pathologies or delay the treatment and create downstream inefficiencies. Lunate Insight CXR detects a maximum of 10 pathologies on chest, AP, and PA X-rays on patients over 4 years old. Critical Scan adds 2 layers of customization to adapt to the specific care pathway. Each modality, X-ray modality of Agfa, can have different pathologies enabled and detected. And also each modality can discriminate the pathologies that need to be detected and archived from the pathologies that require an immediate escalation. How does it look like from the workstation? After an X-ray exposure, the workstation processes the resulting DICOM image with Lunate Insight CXR. In the background, it is totally transparent for the radiographer unless a critical abnormality is suspected. If such abnormality is suspected and detected, then a notification shows up and indicates that the critical finding is suspected and leaves the choice to the radiographer to acknowledge it immediately or later. The pathology detection report includes the secondary capture from Lunate and a color code to indicate which pathology triggered the point of care notification. The workstation displays to the radiographer the Lunate Insights CXR secondary capture and shows in red which pathology or the pathologies that triggered the notification at point of care. In that specific example, there is a risk of several pleural effusions. Based on that notification, the radiographer can then acknowledge receiving the information and follow the local communication protocol. In the PACS, after the exam is then annotated and archived, the secondary capture generated by Lunate Insight CXR is available to the interpreting clinician to support his reading and actually improving his reading. It has been demonstrated that the reading accuracy of referring physician increases by 9% with Lunate Insight CXR. The secondary capture generated by Lunate Insight CXR includes 3 main information for the interpreting physician's review. First, the areas in the chest X-ray where the abnormalities are suspected. Second, the abnormality score, which reflects the probability of presence of the most probable abnormality in that suspected area. Third, the acronym of the pathologies suspected in that area. Lunate Insight CXR has demonstrated an extremely high accuracy of detection of 10 pathologies, with up to more than 99% accuracy for pneumothorax and pneumoperitoneum. In order to adapt to the department's objectives, it is possible to finely tune the specificity and the sensitivity to match optimally the objective of the department where the modality is installed. Thanks for your attention. I hope that video has captured your imagination on how automated, quantified, and repeatable abnormalities detection could support timely treatment of patients and reduce the impact of reporting delays when implemented at point of care.